Welcome, welcome, welcome. Come on in, guys. Come on in, come on in. Happy Monday, happy Monday. Let's start tapping the screen. Let's start tapping the screen. Welcome in, Lisa. Welcome in, Busy. Welcome in, Blue. Welcome in, Sweet Pea. Guys, let's start tapping the screen. Let's get this room warmed up. Let's share this out to as many people as possible. We are going to have an hour tonight. And I got a few things I want to talk to you guys about. So you guys that's in here early, get your pen and paper. What's up, Redbone? Get your pen and paper so you can start taking notes. Let's start tapping the screen. Let's start tapping the screen. Get them hearts going. Letting TikTok know that we are here. And welcome in, everybody. Welcome in. Today we are going to be talking about, of course, giving you tips on having a successful home care business. And I also want to talk to y'all about some state laws, some federal laws that's changing that you guys really need to be aware of. So come on in. Let's start tapping the screen, guys. Hi, blessed child. How are you? Let's start tapping the screen. Get them hearts going. That lets TikTok know that we are here. We are alive. We are a community, and we are supporting one another. So let's start tapping the screen. Get your pens and paper out. We're going to start taking some notes. I'm going to start giving you guys some information that you need to hear about. I'm sharing the live out with some people. You guys share the live out. Let's share the live out with as many people as possible. So we can get us a nice group going on tonight. Because I got a lot of information I want to share with you guys. First of all, did you know that they put a moratorium on hospice care? They're taking no more home care agencies for 6 months for hospice care. And of all the services, hospice care, I find that interesting. The people that need it the most. Guys, let's start tapping the screen. Let's start getting them hearts going. The hearts, just to let you guys know, I don't make any money off of the hearts. That is just us engaging, letting TikTok know that thank you for the heart me. That you are, hi Diamond, how are you? We have talk Tuesday tomorrow at 12:30, so make sure you're there. Guys, let's start tapping the screen. Let's start tapping the screen, getting these hearts out. So, a couple things that I want to talk to y'all about. Okay, they're going to be making, what state are you in? My agency is in Pennsylvania. Right at this moment, I am in Maryland. The federal government is going to be making some changes to Medicaid, and that's going to affect the waiver program. They're talking about having an increase of like 2.4%. I don't know if it's going to happen or not, but if it happens, that'll be good for everybody. But what I want to talk to you guys about, hi Betty, how are you, my friend? What I want to talk to you guys about is how you're making sure that you are efficient in your business, so that your clients will start to refer people to you. Okay. Because referral is really big in this business. Okay. Number one, when a client calls and says that they want care, and you go out to their home, are you doing a full assessment on them? Are you walking around their house and having in mind slip and fall? Are you making suggestions to them? Well, see where this rug is? You could easily slip here. I'm doing great. What about you? I'm actually in a lot of pain today. I don't know what's going on with this hip. Thank you, Crystal. Thank you for becoming a fan member. When you go to the client's house and you're doing an assessment and you're coming up with a care plan, are you walking around their house and doing an assessment on their house? Thank you, Mar. Thank you. Are you doing an assessment on their house? Are you showing that you are educated and you're well informed as an agency owner? What we don't want to be, our community just tied up. Thank you, Crystal. What we don't want to be are just people that we go in and the caregivers tell us what we need and we're like, yes, ma'am. Okay, no problem. Are you giving suggestions? Are you finding out about their pet peeves? Are you finding out what time they like to eat their meals? Are you finding out about their, when you do the assessment, you find out about their medication. Are you asking them about their family? We need to schedule my follow-up. I will be going for 3 weeks military annual. Okay, absolutely. Absolutely. You can send me a DM. I'm actually going to start a Telegram chat also, but I'm going to put in for the people that, hi, thank you for the roses, that got clients for their half-hour follow-up. I'm going to put it in the community so you guys can make your appointments. But when you're going to the house, are you really sitting down and taking the time to get to know the clients and the client's needs? Or are you more worried about signing the contract? Thank you, Betty. Thank you for joining the club. What are you doing? And what should be most important? Should it be getting the contract signed or should it be getting to know the client? Hi, Graceful. Care, how are you? Thank you for the rose. You should be getting to know the client. This is what I tell my salespeople in my other business. Don't chase the money. Let the money chase you. When you get to know the client, they feel that. They feel as though you care about them. You're showing interest in them. Okay? And that's what gets people to start talking about you and your services. Another thing I want to talk about, there is a shortage with caregivers. There's a lot of agencies offering bonuses and a whole lot of stuff to get caregivers. Take care of your caregivers, especially if you have a good caregiver. There's times I'll give a $50 gift card just to say thank you. Okay, because your caregivers are either going to break your business or make your business. Make sure you are training your caregivers properly. Make sure you're having your meetings with your caregivers. Find out what's going on with them. How are you monitoring your caregivers when they're at the client's houses? How are you monitoring them? I showed you guys this before. I utilize WhatsApp to monitor my aides. Okay. See, these are all my clients. These are all my clients' homes. I have my caregivers take pictures of everything they do, make notes of what they do, what's going on with the client, take pictures of their meals, everything. Okay, see, you got a smoothie here. I know what they had for breakfast. I know what their blood pressure was. I know what they had for lunch. I'm monitoring my caregivers. Okay, when your caregivers, let me tell you, the old saying is, when the cat is gone, the mice shall play. Your caregivers have to know you're monitoring, not the agency that I work for. They are very not professional and they're very rude. I am so sorry you're going through that. I am so sorry. There's no need for people to be rude, and if they're unprofessional, they're not going to be in business long. I'm assuming you are a caregiver. So, guys, you want to think about this. It is free to set up WhatsApp. In each one of my houses, I have this going on. Okay. And what I do is throughout what app do you use to monitor? To monitor my WhatsApp. This is WhatsApp. This is WhatsApp. Okay. I got notes in here. I know everything that's going on with my clients because I train my aides on what's expected during their interview. Okay, how someone starts their job is how someone finishes their job. Okay, and I will sometimes have to call the aide. Hey, I haven't seen any notes on WhatsApps. What's going on? So it's your job as an owner to make sure you're managing your caregivers. Yes, you're wearing multiple hats, but you have to think about the things that is going to affect your revenue. And monitoring your clients' homes is going to affect your revenue. You want your caregiver to say, wow, my agency is the best. They on top of everything. If I call, they call me back. If there's an issue, they address it. I was just watching something on the news. It was on WhatsApp, and they did the news did interviewed a couple people that was using a home care agency, and they said one of the biggest issues is caregivers don't show up, or they come in and they don't work. I'm going to make sure my caregivers work because guess what? I'm watching this. My virtual assistant also is in the group. Okay. Anybody that's of leadership is inside those groups. So it's multiple people that can answer those groups and know what's going on. So that's key, guys. If you want to be successful, you want to also do pop-up checks on your caregivers. I don't care if it's one day out the month. You make it different times of the month. You go in there and you pop in there, even if you in there for 10 minutes to see what's going on. The caregiver going to be shocked to see you. This is your money. This is your business. This is your name. So you need to make sure that you're protecting it. Okay. This is how you get clients. This is how you get referrals. Now, something I want to talk to you all about. We are in July. Okay. You guys need to start with your referral partners now with do you have a one-on-one appointment? Yes, I do. All you have to do is right up here where my picture is, hit my picture, then hit my picture again, and then you'll go to my Stand Store link and you can book your one-on-one. And if you book your one-on-one, I'll see it on a calendar, but also send me a DM. The end of the year is going to be here as soon as you blink your eye. You know what happens at the end of the year? A lot of people do their selective surgeries. Why? Because their deductible has been paid. This is when you see towards the end of the year, your hip replacements, your shoulder replacements, your knees. You guys need to be making referrals right now with orthopedic doctors. Okay, this gives you plenty of time to call them 1, 2, 3, 4, 5, 6, 7 times. Okay, before yes, the elective surgeries, before that time of the year come, because those surgeries take a spike at the end of the year. Okay, so let's start planning now. Okay, if you go into, I gotta get the charger, guys. Hold on. If you go into the community and look up the 55 people outside of the box, you see orthopedics is number 1 in there. Okay, every hospital has an orthopedic department. If you just Google orthopedic doctors, orthopedic doctors, you will find so many orthopedic doctors in your area. Guys, I'm going to start trying to use my tablet to show y'all stuff. and hope that I stop getting these restrictions, because I can't keep showing my computer, because I don't want it to be a time that I try to go on TikTok and I can't because I done got so many restrictions because I'm trying to show you. Crystal, I just got your one-on-one. But I'm just going to do a quick search real fast. I'm going to do a quick search real fast. Orthopedic surgeon. Somebody give me their zip code real fast. Somebody give me their zip code real fast. I want to show you guys something. Okay, Crystal. 319. Let me see, what is that? 31909. Hold on. See, this is what's in your area, Crystal. These are the orthopedic surgeons in your zip code area. Oh, let me see. In your zip, see, this is why I hate using the tablet. In your zip code area, I'm gonna tell you how many is in there. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 orthopedic surgeons in your zip code, Crystal. Okay, now let's look at someone else. Now, this isn't, you service more than this area for your agency. Okay, so imagine how many zip codes you service. That's how many orthopedics you could be speaking to. Now, we got zip code 63138. Let's look and see how many you have in your area. You have, oh, you got a lot. Well, so. You have, I'm going to show you. This is yours, okay? This is in your area, okay? These are the people you guys want. I saw it, Crystal. You want to start making a relationship right now, because come November, December, okay, really October, when people after what is that, Memorial Day, people start preparing for their surgeries. But this is what you do when you go in to meet a surgeon. It's a couple questions you need to ask them. Don't go in there saying we do bathing, we do this, we do that. I want to let you know, Dr. Indu, that we're going to give your clients the best care that we possibly can, exactly the way you will, because we're representing you as the surgeon. Now, I have a couple questions that I need to ask you. Okay, number one, what type of exercises do they need to be practicing at home? Okay, what's the best way to help bathe someone that got a shoulder replacement? How do you go about getting them dressed? These are the questions you need to be asking a surgeon. Okay, don't try to sell your business. Okay, go there because you're trying to get the information. He gonna say, wow, Robin Michelle is really interested in knowing how to care for my patients. And they will refer people to you. They will remember you. Okay, when you go back up there again, they're gonna see, when I come into a room, I want you to remember who I am. I want you to remember my name. Okay, they will remember who you are because you were the person that asked, what's up, Dan Flo? I ain't seen you in a minute. You are the ones that's asking questions. How do you manage their pain? Okay, thank you for the heart, Nate. How do you manage their pain? That's another question that you need to be asking. Okay, what if you get a client that gets, when they first get their surgeries, okay, they have a physical therapist that comes to the home. Ask the physical therapist questions. How often should she be doing that? Is there anything that I can do to help her with her exercises? That physical traveling let me get this right. Traveling physical therapist is going to remember you. Every time they come, ask questions. Let me take some notes down, because you know why? They're going to refer you to people. If you don't have a referral source, okay, you're only going to go here in the industry. Okay. Hi, CB. You can be making millions. I did 1.1 my first 7 months in signed contract. Okay. Number one, why? I serviced all of my first clients. I serviced them all. I was at their houses. I knew what was going on. Okay. And that is key. This is, so remember this, elective surgeries are going to be going up right now. So y'all need to know that. I got a quick question. How many people on here are new? How many people on here are new and never have been to my live? If you're new, put new in the chat. Put new in the chat. Put new in the chat if you're new. Okay, we got quite a few new people. Well, let me introduce myself to the new ones. My name is Coach Robin Michelle. I have been an entrepreneur since 1992, and I have been teaching business owners in the United States and overseas how to grow their business. I have been in the home healthcare industry now since 2024. I have been caring for people since 2008. Okay. And what I do is I teach you how to grow your business. I teach you how to make relationships. I teach you what to say at the relationships. I teach you to think outside the box. I'm not going to be the person that's going to say to you, oh, go to the hospitals, go to the rehab. That's not what I'm going to do. I'm going to teach you on how to think outside the box and build your relationships. I have quite a few students of mine. This is our school community, okay, where I do group coaching. And in the classroom, we have the 50 outside the boxes places. Let me show you guys this. And I go over this on live too. 50 outside of the box places. These are all the places you can go and make relationships with these people. And this is how you get your private clients, by all of these places I have in here. I have students that's doing this and it's working for them. Okay. If you go, hi SLS, I think we had an appointment and you didn't show up for your appointment. Hi SLS, I was worried about you. So that's what I teach in the community. How do you get clients? And I'm going to say this because SLS, you need to hear this. Okay. Thank you, Nina, for the heart me. You need to hear this. Right now, you need to start calling orthopedic surgeons. Elective surgeries go on the high peak towards the end of the year, because that's when people have their co-pays paid and their deductibles paid. So reach out to orthopedic doctors. You know what? I'm just going to try. How do I join? Mama Shaw, send me a DM and I'll send you the link. I don't post my, was in the hospital with my brother. Oh, I'm so sorry. I knew something happened and you didn't come to your appointment. Mama Sean, send me a DM, on TikTok and I'll send you the link. And just to let you know, my community is $497, but right now for the first 100 founders, it is $257. We have like 65 founders. And the people that are grandfathered in are going to be the people where I'm going to be picking partners that I'm going to be partnering with, helping them market their business. I'm a private duty only. Can you tell me how I can accept insurances such as BN, Aetna, and UHC? Okay, have you called these companies and asked them how do you get credentialed with them? You need to get credentialed with them. That's the first thing you need to do. Okay? So the companies that you're talking about right now, and guess what, guys? These private insurance companies, y'all need to be reaching out. Aetna, Blue Cross, who else? Let me pull this up. You guys need to be calling them and ask them, how do you get credentialed? Because they all have home care agency divisions within the insurance company. Hi, sweetie. Hi, Dan Flo. I have not. Well, start calling them. Okay. Hold on one second. Something I want to share. Anybody here have a group home or an independent living? Anybody here have a group home or independent living? If you do, put a number 1 in there so I know whether I should share this information. And the community is 257. Mama Sean, 257. Does anyone have a group? Okay. So if you have a group home, okay, or you have an independent living, for the VA, I'm about to give you some hot information right now. Guys, let's keep tapping the screen. Let's keep these hearts going. We need to at least get up to 20,000 hearts today, guys. Once again, I don't make any money on the hearts. This is just showing TikTok that you guys are engaging, and it helps my stats. That y'all not sitting there like y'all watching TV. So keep tapping the screen. Okay, so for my people that have independent homes, and also my people with a, that have a home health care, you want to call the housing division of and speak to a VA care coordinator. Okay, you want to speak to the VA homeless program. It's a VA homeless program. And when you call them, you want to speak to the VA care coordinator. You want to let them know that you have available space for the vets. You want to let them know that you work with the vets. Okay, you provide meals, whatever you do. That is a really good contact for you guys. So you want to look up in Google in your area the VA homeless program and get their phone number so you guys will call them. Or you want to ask to be connected to the Health Connect. Now, guys, another department y'all need to be calling at the hospitals is the surgery center. The surgery center. And ask them what coordinator they work with for families being discharged that need post-care. Okay? That's another big one. You guys can mark it, especially when you're going into the hospitals, okay? On your flyers, post-care, after surgery, bariatric surgery. People with bariatric surgery are bigger people. They're recovering from their surgery. They need help. That's another great one. Welcome in, that you guys need to be making a resource with. Okay? Now, those are your people that you want to be making referral relationships with. Does that require for what, baby? For the VA, the independent homes or the group homes? It all depends on the state that you're in. I told you guys this before. No, that's for home health care. No, it's not a special license you need, because this is just people that had surgery and they're recovering from surgery and they need home care services. People, you got to understand, people like me, I only get my surgeries in the winter. Okay, when the children are coming home during Thanksgiving and Christmas, they're seeing their parents and seeing their parents if they're declining. And that's when they start looking for home care services. So you guys need to start marketing in certain communities now, okay? People are traveling and everything now, but this is a good time, especially August, September. Y'all got a couple weeks, okay? I'm letting you guys know this now. Elderly lawyers. Elderly lawyers are big. Why? Because elderly lawyers who are their clients? Senior citizens, right? They got a database of contacts. Okay, you guys, what would I do with an elderly lawyer? Okay, this is what I go over in my community. We was just on role playing last Wednesday. When I call them, hi, may I speak to the attorney, please? Hi, sir, how are you? My name is Robin Michelle. First, yes, elderly care law. First of all, I just want to tell you, I just want to compliment you on the services that you're doing for our senior citizens. So many of our senior citizens are not getting the proper care, and they're getting taken advantage of. And it is so good to know that we have someone that's going to be speaking for our seniors. My name is Robin Michelle, and I own a home care agency. And we were looking at your website, looking at your reviews, and we would like to feature you this month in our marketing campaign. Get you some postcards from Vistaprint. I tell you guys all the time, stop spending your money on brochures and flyers. Okay? Do all that once you're making $1.1 million. Guess what? I did that, and still I do postcards. Why? You can market your company on one side, and you can market someone else's company on the other side, like an elderly lawyer. Okay? What do? You take a stack of those postcards up there. Guess what he's going to do? He's going to turn them upside down, showing where his business is, and he's going to sit them out there on the desk or something. Guess what? Everyone that picks up that flyer now has your information. Financial advisors. And you say to this elderly listen, I do events in the community with seniors all the time. I would love for you to accompany me and for you to let, the seniors know what your services are. He's going to accompany you because he wants the business. The same thing with financial advisors. Okay, this is right in the community. I have all of these right there. Financial advisors. Okay, financial advisors, this is all private money. You want to make a relationship with them. You want to let them know that you work with the seniors in the community. Okay, this is big. If you get, yes, boo-boo. That was the grandbaby knocking on the door. Yes, boo-boo. He just started to walk. It's so cute. Then he be coming to the office door, knocking on the door. Anyway, financial advisors. Financial advisors are always looking for clients. Say, if you go to a community, I tell you guys this all the time. This is another gem I'm about to give y'all. I'm about to look it up for y'all. Okay, I'm about to look it up for y'all. Somebody give me a zip code. I'm only going to search 2 people real fast. You want private money? You want to go into communities where, okay, there you go. 22556. Let me look in your area. Look at this. I'm going to show you. I got to be careful with my screen not to show my the URL. Okay. Look what I can't show the URL, y'all. This is what I just searched. 55 plus new construction. 55 plus active communities in your area. Look at what the prices of these houses are going for. 300. My mouse don't want to. 300 to 400. Can y'all see this clear? Hold on. Okay. $300 to $400,000. Okay. This is the places that you want to be looking at. Let's look at this one. Let's look at this community. Let's look at this community right here. Copy. Let's put this in here. Paste. Let's look at it. Let's see if their website comes up. Here's their website. Here's their website. This is the community, your new construction community. Okay? This is what it looks like. This is what the community looks like. This is 55 and older. Okay? They got their meeting house. Let's look at their meeting house. This is the meeting house right there. Look at the pool. Look at this. What is this? This is private paid clients. Okay, let me turn my screen around. You want to call these places. Good afternoon. How are you? May I speak to the office manager? And they'll connect you. Hi, my name is Robin Michelle. How you doing this afternoon? That's good. First of all, I want to tell you, you have an absolutely beautiful community. And I was looking at your community. I've been looking on your website. It is absolutely beautiful for our people 55 years and older. I was looking at the reviews. It is phenomenal. My name is Robin Michelle, and I work with seniors in the community. And we go out to facilities as communities as yourself, and we teach ours the people in the community what the early signs of dementia is, what the early sign of Alzheimer is, how to stay in your home, or you could say about COVID. People don't realize COVID is going rampant right now. Guys, let's keep tapping your screen. Let's keep tapping your screen. It's going rampant right now, and it's more people dying than they were in the beginning, but it's not on the news. And you show yourself as an educator. Okay, what we would like to do is come out to your community, and along with myself, I have attorney such and such coming with me. I have a financial advisor, whatever the name of his company, that will be joining me. The attorney will be talking about his services. Okay, these are the type of relationships you guys want to make. I'm going to look at another area. 55 plus. Community new construction. Let me see who was next. 6-3. Let's look at 6-3 138. Let's see what you have in your area. Oh, you got 3 in your area. And guys, this is just in your zip code area. Okay? Not the area you're serving. Look at that. You have 3 right there in your area. Okay, this one is senior apartments. Let's look at them. This isn't new construction, but that's not a bad one. Do I got new? Yeah, I got new construction in there. Roundabout. You have a couple, there. Oh, it says there's no current construction. Let's do, in your zip code area. I don't know what state you're in, so I can't look it up. So you would have to go a little bit outside your area. But you do have some senior facilities in here. Like this one. If I looked at this one, this is the first thing I see. Their rent is between $500 and $800. When I would call that place, I would say to them, any residents that you need that need the waiver service, we will do everything from them from A to Z. Okay, help them get into the waiver services. If they need a scooter, whatever they need, that's what you inform them of. So guys, it is really important that you start making these relationships with people. This is what's in my community where you guys will do. Now, I got something big rolling out to my community on tomorrow. And I got 100 places. I'm going to show y'all. Okay, but I can't really get into it because I gotta let the community know first. But I'm so excited. I am always looking for places for you guys to get opportunities to meet with people. Now, you know how you be calling the hospitals and you be calling the rehab, you can't get no social workers on the phone or none of that. I've done found places where you guys, it's 100 different networking conferences and events, and they're basically in all 50 states. Let me show y'all. Anybody in here in the community, watch out for tomorrow. Look at this list. Look at this list. Look at this list. I'm going to just pull one for you all. Let's look up the Senior Expo. I'm going to just look up one. I'm going to look up the Senior Expo. Let me get a zip code. What zip code was I just on? Let's do this zip code. Zip code 31015. 310 KC. This is in your area. This is the Senior Expo. Where's it go? You don't have one in your area coming. Let me look at another zip code. But what you do have in your area is the Middle Flick Council of Aging, and the River Valley Agency of Aging. This is for the regional senior programs. And the other one is it provides daily activities, social events, and nutritional lunches for seniors and older. Okay, that's what's in your area. That's what comes up. Oh, you know what? Maybe because I got it spelt wrong. Hold on. Maybe because I got it spelt wrong. Let me see. Okay, you got it's just showing the Chambers of Commerce. Let me look up another zip code. I should have told y'all to put y'all states in here. Okay, so for the person in zip code 27404, you have a senior lifestyle health and home expo that's coming November the 4th from 10 a.m. to 1 p.m. The event is completely free, includes free parking, food giveaways, and health screening. Okay, this is a place you need to be at. It's going to be, let me turn this around. It's going to be nothing but seniors in there. Nothing in seniors in there. Take your postcard. Don't start giving them out. Just start talking to people. You see somebody with a cane. How you feeling today? I see you on a cane. What's wrong? Oh, you had to have hip surgery? Wow. When did you have to have your hip surgery? Get to know the people before you give them your business card, before you give them your information. Guys, you guys are taught to sell your business, okay? That's not how you sell your business. You sell your services. You sell why you started your agency. When I go to facilities, I tell my story. Why I started a home healthcare agency. I've been living in chronic pain since 1997. I have from 1997 to 2010, I was told it was in my head. I was diagnosed with MS, with lupus, with Lyme disease. Then they said they didn't know what was wrong with me. I didn't get diagnosed until 2010. I've been in and out of rehabs. Right now to the day, I need 6 surgeries. I have a rare form of arthritis that's attacking all my joints. So I'm bone on bone all over my whole body. So I live in chronic pain. I know what it feels like to want a cup of water and can't get up and give it. And I've been in and out of these facilities, and I see how seniors and disabled people are treated. And this is why I wanted to open up a home care agency so I can give people better service. Then I go into my agency. Okay, that's what you guys need to do. Let me look up a blessed zip code. Let me see if you got a senior expo. I got in here. They got social worker conferences. Social worker conferences. Imagine being in a room with 200 social workers. Okay, that's how you get relationships. Calling the hospitals are great. Don't never stop calling the hospitals. Okay, but you find the places where there are when they're not at work. Okay, you got an expo coming. Who is this? Blessed. You got an expo coming. You got, what's that? Rock, I can't even say it. Valley Agent Expo, hosted at the Kirkwood Adams Community Center. You have one that's coming in your area. Let me look at someone else's zip code. Let me look at someone else's zip code. Who's next? 27870. Okay, are you also in North Carolina? Yeah, okay. Oh, both of y'all got the same zip code. Both of y'all got the same zip code. Okay, let me look at somebody else. 21125. Okay, here you go. You got an expo coming. Look. The Baltimore County Power of Age Expo, the 39th annual Expo, is Thursday, October the 22nd at Maryland State Fairgrounds. The admission is $2. Got what to bring? Your Medicaid Part B and Part D cards. Okay. These places got nothing but seniors in it. Nothing but seniors in it. Okay, you guys got to look at the different events that's going on. Let me look at Graceful. Let me see what's coming in your area. And I'm gonna look up one more for you all, and then that's it, because I gotta show it to my community first. Oh, I put the wrong zip code in here. Oh, I'm sorry. Jules 199. Jules 199. You got a couple coming to your area. Look at this. You got the Beacon 50 Plus Expo. Prince George Country Senior Fair is coming. The Bowen Senior Citizen Center events. You need to look this up. You got a couple of them coming in your area. Okay, now let me look up Graceful. I don't know how my eyes jumped. Let me look and see what Graceful got. 33462. Let me see what you got in your area. Hey, Graceful. Anybody in Florida, SLS, Graceful, Mar, y'all paying attention? Y'all all in Florida. Y'all all in Florida. Look at this. Look at this, guys. It's 3 coming. The Palm Beach County Senior Expo is coming. Okay. The Bayton Beach Fair Senior Fairs. The South Florida Senior Show. Guys, let me tell y'all what y'all need to be doing for these senior expos. Y'all need to be calling them, asking how you can become a vendor. Did y'all hear me? Y'all need to be calling them, asking them how you can become a vendor. You're going to be in the room. Let's look it up. Let's look up at the Palm Beach County Expo. This is what I'm about to look up. I'm about to show. See, this is what I do. Oh, hold on. This is what I'm about to look up. Y'all, my Florida people listening? My Florida people listening? All right, let me see. 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 Ah! My Florida people. My Florida people. My Florida people. Are y'all listening to me? My Florida people. Hello, Florida people. Can y'all put a $ in here before I show y'all this? Can y'all put a $ in the chat? My Florida people. Where's my Florida people? Palm Beach is 4 hours away. That's all right. We got a couple other ones. Okay. But guess what? It might be worth Palm Beach 4 hours away. That's not the area you're serving. Okay. So I just looked up the Palm Beach, but this just gives you an idea. I want y'all to see what it says. I just typed in there approximately how many people will be there. Hundreds to thousands of local seniors. This is going to be September 17th, 2026 from 10 a.m. to 3. Guess what? When I tell y'all I got the stuff in the community, I got the hookups in the community. Okay, Mar. I'm excited now, y'all. Mar. Give me your zip code real fast, Mar. Let's see what's coming in your area. See, all these conferences and everything, they're just now, that's just when they're coming. Mar, where you at, Mar? 34373. Let me see what's in your area. Hold on. Let me see. Why? From Woodland area, 34310 is not a standard or, wait a minute, do I got the right zip code? 343. Give me another zip code. It's saying that it is not a standard something zip code. Give me another zip code, Mar. Oh, 44. Okay, that's what okay, 4. Okay, 4. Okay, here we go. Let's see. Y'all, I be feeling like I'm at the casino when I be doing. Yes, you do got one coming to your area, Mar. Yes, you do. What are you trying to look? What are you typing it? I'm Google. Y'all know I make it easy. Mar, yes, you do got one coming to you. Look, Mar. You got 2 coming in your area, Mar. Look, the Senior Health Expo, November 20th, 11 to 4. And there's another one that's coming. You got 2 October 20th. Okay, if you're looking for vendor opportunities, you can check the registration platform. You got another one. Oh, you got a couple more. You got the Senior Expo USA Florida. Let's look at this one. The Florida Senior Expo. Company logo and attended emails. Name of company, attended emails. Benefits before Expo, press release. Benefits during Expo. Oh, you guys got a lot. And guess what? It's a phone number right there. It's the person's right there who's handling it. Okay? Guys, I wish I had time to look up all you guys' zip code. When I'm telling you this list that I got, This list that I got is basically for all 50 states. If your zip code does not come up, please just put another zip code in. Don't say, oh, it ain't nothing in my area. Just put another zip. That just means it's not in your zip code area. Or you just go in and put one near you. No, you ain't seen nothing, Mar. You in the community, so you gonna get access to the list. It is one for social workers. It's a conference for social workers. Let me go back to the list. Listen, I'm gonna tell y'all the conferences. Look, I can't do that. I gotta be fair to the community. God, I want to tell y'all this. Y'all just gonna have to wait till Thursday. I want to tell y'all so bad, but I gotta be fair to the community. Oh God. Okay, I'm not even gonna do it. But one more I'm gonna tell y'all about, and then that's it. The CEO roundtable. Okay, wait a minute. Post and look. Oh, Rose, you want me to look you up? I'll look you up, baby. That'll get me distracted because I want to tell y'all more, but I can't. I can't. The community comes first. Just like the community gets on. Guys, y'all in the community, y'all better go check the community for the grants. 953. I know. I'm trying to be, more I get excited. Y'all gotta wait till Thursday. I gotta give the community 2 days. Okay, so you just gave me Florida 34953. The expo had all, baby, the expo already passed. But you can stay updated. It came June 16th. I'm sorry. But give me another zip code. We're waiting on you. Look, y'all know. Guess what? I might go over this. Give me another zip code. Darn. She just missed it. I know. Let's look at another zip code. Road. Oh, how did someone just get on here? Did I accidentally invite?
Bro, ne yapıyorsun bro?
Oh no, you definitely got to get off my live. 86. Let's see. You got it, girl. 34986. Yes, you do got something coming, girl. Let me show you. You got, look, the Treasure Coast Senior Expo. Oh no. Oh, here you go. Strike Out Hunger for Meals on Wheels. You know it's going to be benefiting seniors of September the 19th. And then it says go to the Senior Expo calendar to find upcoming events for 2026. Okay? Guys, this is what I teach y'all. I teach y'all how a CEO thinks. Okay, you got to think outside. Hold on. Oh, sugar, hold on. Oh. Okay. You got to think outside the box. Okay? Look, I get agitated. I'm calling up to the hospitals and I can't get somebody. Guess what? I'm going to find out where you at. In the community, in this list, I got physician conferences. I got rehab conferences. I got assisted living conferences. All of that is in there. Okay? Where you can go. How do you think it's best to get client? Just what I'm telling you. Just what I'm sharing with you now. Some of these conferences has hundreds of thousands of senior. I got to let the dog in. Hold on. He's so spoiled. Come on. Child, I could barely walk today. Um, who just asked me, how do you, okay, free man chronic list. Look, this is what I have in my community. And I have went over this so many times on live. Hold on. Let me go to the classroom. This is the classroom, guys. Let me show you. This is the classroom. I even show y'all how to build y'all business credit. I don't want y'all just to get clients. I want y'all to know how to be successful. Okay, here you go. 50 outside of the box places to find private clients. These are the people you need to be calling to make relationships with. These are the people that got a pipeline of seniors. Okay, right there. Okay. Now, this one right here, the 18 proven strategies, these are the places I went to when I made the first 1.8 mil. Okay. And signed contracts. Okay. It has it all broken down. Okay. Also, how you get clients. I'm going to tell you another way you get clients. You make partnerships with other agencies. Home health care agencies. Home health care agencies, they go. Home health care agencies goes to clients to do wounds and stuff like that. They can tell you if you're going to go to the senior places, 62 and older, you ask for the event coordinator. See, you guys are calling these places and y'all don't know what to say. So you're getting the standard, let me send you the voicemail. Send me an email. May I speak to the events coordinator? Events coordinator get on the phone. Hey, how you doing today? How's your day going so far? I had 2 calls today and I made phone calls for them. How you doing today? That's good. I called one girl today. I called the mayor's office for her. Don't play with me. I'm calling you because I'm calling to find out when you have availability for your calendar for next month. I would love to come do an event for your residents. Do they like bingo? Do they like word trivia? What do they like? You know, we'll bring gifts, we'll bring refreshments, and you go in there and you do your thing. Or if you guys, this is what I would recommend. Especially you guys in the community. I keep telling y'all to talk to one another. Y'all need to find out who's close to who. And y'all need to put on a big event in your area for seniors. Okay? All you got to do is find a park, go get a permit for a certain day, and then you can put an event on and just pass out flyers. That's what I was calling the mayor's office for the the student I was talking to today. Okay. But you got so many conferences. It's places that I have where it's nothing but doctors there. It's nothing but nurses there. It's so many opportunities for you guys to get clients and be successful. But all this that I'm giving you guys is going to be no good if your caregivers are not properly trained. If you don't have a care plan, okay? If my system was here, I would show y'all. For each house, I got typed out a care plan of exactly what they need to do when they get started. I go over that with them on the interview. How do you retain caregivers? Let the caregiver and the client have an interview together before you hire them. You can do it I do everything over Zoom. You could do it over Zoom, or if the person lives in the area, you could send them to their house. It's these little tips that you guys need to know to make you successful. Okay. I just saw Miss S in here. Miss S, you guys got a big treat coming out to you guys in the community. But guys, you guys in the public, y'all gonna have to wait till Thursday, and then I can tell you guys the different places you can go for the conferences and the events. That's what you got to do. You got to think outside the box. I don't want to, if I'm going to spend my time, first of all, I'm hurting. So if I'm going to go someplace, I want to have a room full of people I'm going to talk to. Okay. I want a room full of Thursday or Wednesday. For what, baby? When am I releasing it? No, I'm releasing it tomorrow. If you in the community, I'm releasing it tomorrow. And tomorrow I'm having a Talk Tuesday from 12:30 to 1:30 tomorrow. So I might go over it tomorrow for a little bit, and then I'm going to go over it Wednesday. Okay? Because you guys need to go. Amelia, she was on here. I told you guys about the Lions Club. She went and looked up the Lions Club. She found an event. She bought tickets for her and her husband. She said, Miss Robin, you wasn't lying. It was Ferraris there. It was business people there. It was everywhere. The places where I'm telling y'all to go is where y'all can network. But when you go, you got to go there right. You got to stand in front of the mirror and you got to go over your speech over and over and over and over and over again. Because if someone asks you a question, you don't want to be, then, you know, they're going to say she don't know what she's doing. But guys, if you're interested and if you want to do a one-on-one call with me, I do a 60-minute strategy call to where I look at your business, what your business needs are, where you need to improve in, and I set you out a plan for how you to grow. So if you're interested in doing a one-on-one call to me, you could just go in my bio and hit the link. Now, if you're interested in joining the community, you have to send me a private message because I don't have the community link out in the public. But just let me show you what is in the community real fast. Okay, so I'm going to show y'all this. And guys, this in the community, I want y'all to see this too. Okay, first of all, let's go to testimonies. Let's look at here. What this one of my students says. She just got her second client. See that? Let's go here. Nurse Fabulo got her first client. Courtney got her first client. Betty, who's online, got her first client. Business Savvy landed her first client. Okay, it's people that's getting the clients because they're following the blueprint. And I got more people that I have to put in here. Then here, guys, I'm in the community. Yes, she is. Guys, and here you have your grants. It's a grant for $4,200, a grant for $10,000, another grant for $10,000, another grant for $10,000. I show you guys where to get the grants from, how to get the grants. Okay, then you got the classroom. This is where you start at, Jumpstart. Okay, you go in there. You got your videos. You got your lessons. You got your videos. After your videos, you have your workbook. You can fill your workbook out online. I had Butterfly. She went in the community. She said, Miss Robin, after I watched your videos, I tore up everything I had, what my business idea was, and I started all over again. You have over 17. Oh, let me show y'all what else y'all got in here. Oh, Mar, this is what you need to look at, sweetie pie. This is what I was just telling you about, Mar. The resource. First of all, you got scripts in here. I got y'all some scripts. Then you got templates. Okay, look, Mar. This is the client referral package. You got that in there. What you gonna need for when you get the client. You got your caregiver communication. You got your complaint log. You got everything that you need. You hit it. You can edit it. You can add your information on there. Everything that you need. Okay. All right. So guys, does anyone have any questions before I get ready to go? Does anybody have any questions before I get ready to go? What I will do is I will come back tomorrow.
So you're probably not going to...
Hold on. Let me see something. Hold on. Okay, I'm sorry, Nina, I'm sorry. Let me put the information in. You sent me a message at 7:59. I apologize. Let me put it in for you, sweetie. Is anyone, would you like the information on how to join the community? We have live coaching on Tuesdays and Wednesdays. I am available through DM. I am available through TikTok, or I am available in the community to answer any of your questions. The goal is to help each and every one of you to be successful. I will. Okay. Can you send me a DM real fast? SADE. Can you send me a DM real fast before I go? And everybody in the community, look out for tomorrow. You guys are going to have the list of all the conferences, all the expos, everything. And most of all of these are in all 50 states. So if you put your zip code in and it doesn't show, add another zip code. I'm going to show y'all again real fast everything that's in there. This took me a minute to put together for you guys. Look at this. I did the thing. You got your business network, your health organization conferences, your legal, your conference and trade shows. Look at this. Hospital expo, medical expo. I can't tell y'all. You got your profession. You got it's. All I can say is, guess what? If you want to make the money, I'm showing you where to go. I'm showing you how to get the clients. Hold on one second. I'm showing you how to get the clients. I'm telling you what to say. And once again, let me just go over the community. It's $497, but right now it is on special for $257. It is a lifetime membership. I missed this entire thing. Will this be saved so I can watch it? Yes. We're gonna start. Matter of fact, I gotta ask RJ because I keep asking him. We're gonna start putting the lives in the community. Hey, how about guys? You know what? You never text me. Alicia, I hope I'm saying it right, and tell me whether I can tell everyone. Can you show me? I sure can. Hey, beloved's home care. Hi, sweetie. How are you? You missed a good live. Y'all missed a good live. Alicia, can I say something? I'm in Phoenix area. That's okay. You could be, guess what? All 50 states is fine. All 50 states is fine. I'm waiting for her to answer me. Okay. All right, guys. It's going to be in the community. Alicia, why don't you put it in the, I think you have your live videos catalog in. No, those are other videos. Those aren't the lives. RJ has been downloading the lives. They will be in there. Alicia, that would be a great idea if you post lives in the community, because sometimes I'm not, we're all of the lives are going to be, matter of fact, let me send him a message again, because I keep telling him, okay, RJ, I need the TikTok lives. Hold on, guys. I'm sending him a lives in the community. Okay, I just sent him another message. Okay, wait a minute. Alicia, I think you have, oh no, that's not her. Alicia, are you going to put it in here, sweetie? Are you going to put the link in here so I can tell everybody? If you could put it in here and pin it. What is the community you guys talk about? Do you have to? Yes, you do have to join, Norma. That is where we have our live coaching. That's where all your training is, all your resources, your clients, everything I've been talking about. I don't know how to do that. All right, so text it to me real fast. Let me show you the community again. The community is an academy, and it teaches you. Thank you, Mar. She just said it's like an academy. Absolutely. It teaches you everything you need to know. What is the cost for your trade? Well, for the community, it's $497. It's a one-time lifetime membership, but right now it's on special for $257. Okay, this is the community, guys. This is where all the announcements are made, all the posts are made, everything that's going on. This is how we communicate with one another. This is where the classroom is. These are all your lessons, your videos, your training, your scripts, where to get clients from, cracking the VA code, how to get, when they tell you that they're no longer accepting VA providers. Okay, here are 5 other programs that you could go to get VA clients, and you don't have to be a provider. This is for group home, the blueprint for private pay. This is for the AI. I've been distracted. I got to put my AI twin in there. This is for the business credit. This is your resources with all the templates, contracts, everything that you need in there. This is your quick start. This is how to get ads, but it's so much information in there. And you get me. You get me. Send me a DM. Okay, Mama, I'll make sure you have access to everything as soon as I get off. Send me a DM so I can send you the link. Because after our 100 people, it's going to be going up. Very good. Okay, send you a DM. Yes, send me a DM. It's going to be going to $497, and this time next year, it's going to be $9.99 to get in. So everyone that has gotten in, you guys enjoy it, because that's what I'm building. I'm building an academy because you guys are able to get your home health care license, but nobody is training you guys. Nobody is training you guys how to market. Nobody is training you guys on what to say. I posted, can a mother work for her son more than 40 hours in the state law that you could be audited? No, it all depends on the agency. Do you give one-on-one mentoring in your program? No, but if you want okay, so I have 2 types of mentoring. I got your one-on-one strategy call. I'm so glad I'm one of the first. Yes, you got your strategy call where it's 60 minutes where I've designed your blueprint on how for your business to grow. And that's a 60 minutes and call, and you could get that by hitting my picture, going into the link. And if you want the mentorship one-on-one for me to work with you, it's anywhere from $3,500 to $10,000, all depending on what you want. I posted it, but I can't pin it. I posted it, but when I'm trying to see it. Okay, here you go. Guys, how can I copy it? I can't. Let me pin it. Pin this comment. Okay, guys, I just pinned. Okay, let me explain something. We are a sisterhood. We help one another. If somebody is in trouble, we all rally around them and help them. I just pinned a GoFund account. It's a young lady that has an agency. Okay, she's starting her agency. She already has her license and everything. And this shows you guys how privileged you are. Okay. And she has been in a shelter for 13 months. She has a daughter that's autistic. So it's her and her daughter, and she's been building out her agency, okay, for the past 13 months. She's been following my blueprint like I don't know what. This girl she doing that 50 outside of the box. She got so many relationships of people that want to do business with her. But unfortunately, she's in Georgia. So she has a GoFund account that I helped her set up. So if you guys will go to the GoFund account, even if you contribute $5, $20, I sent her $100 yesterday. You know, you can read her story, but I ask you to please support her, and it's also going to be in the community. What's the cost for? I think I answered that. Okay, how do I join? I think I answered that. Can a mother work for her son more than 40 hours? It all depends on the agency you want. Thank you, beloved, for that. I think I have it. Thank you for the populars. Thank you for the populars. Okay, guys, I am going to go. Anyone that needs me, just send me a DM. Anybody that wants to join the community, send me a DM one-on-one. Go to my bio. You guys have any questions, you need anything, DM me and I will get right back to you guys. Everyone have a good evening and thank you very much. Bye, guys.